Welcome back. Day 11 of the 30-day Healthy Heart Marathon by Menopause Energized. Hey, welcome back, you guys, to day 11 for the Menopause Energized program. This is Sheila again, health coach, registered nurse, and we are back to talk about EKG today. Some people will say ECG, electrocardiogram, and I'm going to explain the reason why this is important. I'm not going to bore you with a whole course on strips and things like that. I just want to make you aware again and the importance. If you missed day one, go back to day one. That's when I talk about the heart and the signs and symptoms of a heart attack. We will not go into full details about that again today. I just want to explain the importance of being familiar with your EKG. And I say EKG, but most of the time it's really ECG, electrocardiogram. For the menopausal women that is on this video right now, if you have not been keeping up with your yearly physicals, please make an appointment to have your yearly physicals done, because in those physicals, the doctors are going to be doing the ECG, and that's so important. Again, what did we talk about? And I keep saying this probably in every video. Cardiovascular disease is a high risk in women in their menopausal years because of the estrogen taking a dive. And we talked about the estrogen and the heart earlier. I don't know if that was day 2 or day 3 of the video. We went into a full detail in that, so I won't go into that today. So why is it important for you to be familiar with your EKG? Well, we just discussed a couple of things just now. Another thing, remember we talked about day 1. We have large vessels in the heart, and we have what we call small vessels, micro vessels. Women have them and men have them. But research shows that what happens is, for women, sometimes when we're having a heart problem, it affects sometimes the micro vessels. So the smaller it is, the more subtle symptoms we're going to have than men. Again, you still look out for the universal signs of a heart attack. Very briefly again, the shortness of breath, the chest pain. The pain can radiate down into your neck, your jaw, to your neck, to your arm, and actually, yes, back pain as well. Did I say the shortness of breath? It don't always have to be crushing chest pain or like an elephant is sitting on your chest, and this is where some people kind of miss out at. You can have chest pain as subtle as indigestion. And here I go again with the women. This is what I talk about, subtle symptoms. Indigestion, men can have it too, but for women, a big one, a really big one is shortness of breath. Women can have shortness of breath and no chest pain. Now, besides if you have a history of asthma or what we call COPD, chronic obstructive pulmonary disease, if you really don't have any of those, you really should get your shortness of breath looked at by your physician, because that is a really major symptom as well that a woman can have. Just feeling tired and washed out and shortness of breath, there's a possibility that it could be something going on with your heart. So it's important to get your yearly ECGs done. When you go into the doctor's office and the doctor does the ECG, believe it or not, an old heart attack or old MI, myocardial infarction, we talked about it earlier, because the infarction happens in the myocardial tissue of the heart. And so sometimes an old heart attack can show up on there. And you know why? Because apparently the person that has that old MI showing up on the EKG is because somewhere along the line they must have had some type of subtle symptoms that they just did not pick up or did not think was really important. That's why I say for women, please watch out for those subtle symptoms of maybe some indigestion, some shortness of breath, and feeling just profound like weakness. But again, they're not the only symptoms. You can have all the regular universal symptoms of a heart attack as well, same as what men have. And it goes for men too, same way. Men, you can still have the indigestion and shortness of breath. I'm just letting women know that for women, sometimes it gets missed. That's all really the biggest thing I want to say. When we have that shortness of breath or little subtle signs. Sometimes in women, for us, the MI gets missed. So that's really important. Don't be afraid when you go to the doctor's office to relate any symptoms. Sometimes people don't talk about the symptoms, and I say, what you saving them for? Tell the doctor if you've had some chest pain or some shortness of breath or just feeling weak. Any of those symptoms, that's when you're supposed to tell a doctor, is when you go to the doctor's office. Not to hold back, but you'd be surprised how many people will go to the doctor's office and not tell a doctor how they're really feeling. And that's not going to help with the collaboration or partnership of your care. And like I said, we already talked about symptoms of heart attack in women. Now, I just want to go through briefly when the ECG is taken in the doctor's office. Normal sinus rhythm is what they like to see. They're hoping to see a normal sinus rhythm. You're hoping that it's going to be okay as well. So when you see a normal sinus rhythm, the heart rate is usually between 60 and 100. Not in everybody now, because for me, 100 would be too high. I would be able to feel it. It just depends on what your average is. That's why it's good to keep an eye on your blood pressure when the doctor takes it and your pulse, so you can find usually what does your heart rate range at. Because for some people, 100 is a little too high. Their body's not used to that. A person that's an athlete, because their heart is so trained, they'll usually run a low pulse rate. Sometimes, not all of them, in the 40s. At night when we sleep, our pulse rate usually drops. So for some of us, it's not unusual for our heart rate to drop in the 40s and 50s at night. Now, for some reason, at night you wake up and you actually feeling there's something wrong, you definitely need to get that checked out. But most of us can sleep through the night and our heart rate drops and we never know it and we never feel it. So here you have, in the normal sinus rhythm, again, 60 to 100 is what the American Heart Association says is normal for a pulse rate. And again, blood pressure less than 120 systolic and less than 80 diastolic. So you have your P wave right here. This little spike is your QRS wave. And then over here that goes up in the hump again is your P wave. And then it'll go flat and then you'll start all the process over again. P wave, QRST. And that keeps going. The reason why this is a normal sinus rhythm, because in between each of these intervals of the QRS intervals, the spaces are equal. They're equal in the intervals. There is no irregularity. So this looks like a normal, this is a normal sinus rhythm. Now, for irregular rate, it necessarily don't have to be anything wrong going on. Just some people run irregular rate due to a lot of factors I won't go into, but one of them is what we call premature ventricular contractions that just happen sometime. Sometime when you drink caffeine, caffeine will help bring on those PVCs. But if here, in between these intervals, it's a little irregular. It's not the same space. This here is a little, these two QRS come closer together than these two QRS here. So it's a regular rhythm and don't necessarily mean something is wrong. The third one is sinus tachycardia. Again, that can be acute and can be fixed, especially in a person with dehydration. We have a lot of patients that come in that was dehydrated, and of course there's sinus tachycardia, just like when you're sick with the flu. The fever, you have a fever, you're probably not drinking well, you get dried out, so what happens, you have tachycardia. And the way to fix that is to hydrate a person. There's other reasons for tachycardia, I'm just giving you one simple one. A lot of times it's being dehydrated, but there could be other problems going on. One of the ones you really want to be careful with is when this sinus tachycardia, if you can see it down here, if you can zoom in, starts to get a irregular rate like this. So you got sinus tachycardia with an irregular rate. We call it, it just depends if it's irregular. It's called atrial fibrillation. I know you guys probably heard of atrial fibrillation. That we want to be careful with, because that one can, because it's so irregular and fast, it can actually throw off a clot. And then that clot could possibly go to a major organ. Sometimes it could go and just dissipate, but we have to watch it because sometimes it could go to a major organ. So atrial fibrillation, that's rapid, we call it rapid ventricular response, I believe. We do treat that. We have to treat that. And we treat that with drugs to bring the heart rate down. So that's all I want to talk to you about with the rhythms. I didn't want to get too much into that. But yes, you should definitely know what your ECG reveals. Have your doctor tell you. Just don't have them say everything looks normal. You want to know, was it a normal rhythm? Was there some tachycardia that let them know? Good reason to know as well. If you ever have to go into the ER and something is going on with your heart, and the doctor sees something a little irregular on your ECG, if your ECG was normal, where the doctor gave you results that you had a normal ECG, at least you can let the doctors know then, hey, you see something now, but I've been getting my yearly ECGs in my doctor's office and they've always been normal. Then that can give them some little ideas or cue on possibly what they can do next or investigate, what needs to be done. Don't have to be anything serious, but it just gives them a little bit of information, more information, until they get your old records. And so key takeaway, menopause, again, raises heart risk, cardiovascular disease. So you definitely want to make sure you have your yearly ECGs. If you haven't been getting your yearly physicals, you really need to start now. We have so much we need to start looking at now in our menopausal years because that estrogen affects a lot of things. But for this 30-day marathon, of course, we're only talking about the heart right now. Let's see. And again, we just said it, get your yearly physical. And then again, ECG takeaway can detect some abnormalities with your heart. And that's why we call some of them the silent heart attacks, because you can go in and the doctor will say, oh, you've had some type of ischemia in the past to your heart. It shows up on the ECG. So that's all I want to talk to you about today. I just want to some people may say, oh, I go get an EKG or ECG at the doctor's office, but you want to know a little bit more than that. And when you walk out that doctor's office, definitely have the results more specific about what the results were. And basically, that is it for today. And I will see you tomorrow on day 12. Take care. And as I always try to remember to do, take care of your heart until the next time. Always, I think you've learned the tip for today that you can take away today. And that is, if you have not made your yearly physicals, make sure you get an appointment with your doctor. It's so important for us women in our menopausal years. See you the next time.